Constipation is a common digestive issue characterized by infrequent bowel movements or difficulty passing stool. It can vary in severity from mild discomfort to more severe complications. Here's an overview of its causes, symptoms, and potential treatments. Causes: dietary factors, not consuming enough fiber-rich foods, inadequate fluid intake, and excessive consumption of processed foods can contribute to constipation. Lack of physical activity, a sedentary lifestyle can slow down bowel movements and lead to constipation. Medications: certain medications, such as opioids, antacids containing calcium or aluminum, and some antidepressants, can cause constipation as a side effect. Medical conditions: conditions like irritable bowel syndrome, IBS, hypothyroidism, diabetes, and neurological disorders can affect bowel movements. Ignoring the urge. Ignoring the urge to have a bowel movement can lead to the stool becoming harder and more difficult to pass. Pregnancy. Hormonal changes during pregnancy can affect bowel movements and lead to constipation. Symptoms: infrequent bowel movements less frequent than usual, often fewer than 3 times per week. Hard, dry stool. Stool consistency becomes dry and difficult to pass. Straining, struggling to have a bowel movement and spending an extended time in the bathroom. Abdominal discomfort, feeling bloated, uncomfortable, or experiencing abdominal pain. Incomplete evacuation, sensation of not fully emptying the bowels after passing stool. Rectal bleeding, due to excessive straining, small amounts of blood might appear on the surface of hard stools. Treatment: dietary changes. Increase fiber intake by consuming more fruits, vegetables, whole grains, and legumes. Fiber adds bulk to the stool and helps it move through the digestive tract more easily. Hydration. Drink plenty of water throughout the day to soften the stool and prevent dehydration. Regular exercise. Engage in regular physical activity to promote bowel movements and overall digestive health. Laxatives. Over-the-counter laxatives can provide short-term relief, but they should be used sparingly and under the guidance of a healthcare professional. Stool softeners. These medications help soften the stool, making it easier to pass. Prescription medications. If constipation is due to an underlying medical condition, a doctor might prescribe medications specific to that condition. Lifestyle changes. Establish regular bowel habits by visiting the restroom when you feel the urge and not delaying the process. Biofeedback. In cases of chronic constipation, biofeedback therapy can help retrain the muscles involved in bowel movements. Surgery. In extreme cases where other treatments are ineffective, surgical intervention might be considered. It's important to note that chronic constipation or sudden changes in bowel habits should be evaluated by a healthcare professional to rule out any serious underlying conditions and determine the most appropriate course of treatment.